Welcome to this introduction on the Barium Enema examination. In all of my presentations focusing on radiology, I've been explicit. We're not trying to make you a radiologist. Rather, we want to demonstrate some normal basic anatomy as viewed through radiological studies. Of course, some pathology is introduced so you can compare and contrast the normal to the abnormal. So let's start with this Barium Enema examination. Here, I've labeled the appendix and portions of the colon. In this film, you can see the appendix, the rectum, and several small diverticuli. The diverticuli resemble small peas that look like they've been glued to the outside of the colon. This colon is quite redundant. It's this redundancy which makes performing a colonoscopy difficult. Again, in this image, the appendix can be seen and an almost three-dimensional view of the hepatic flexure becomes obvious. As we move forward in this oblique view, the hepatic flexure of the colon becomes even more prominent. Hopefully by now you realize the form and figure and length of the colon is hardly how it looks in your medical textbooks. Here the rectum can be seen diving somewhat posterior, and the sigmoid takes a sharp curve. Performing a colonoscopy on some of these patients is challenging. Not only is the colon lengthy and redundant, the length differs from person to person, but we have to make it through several areas of diverticulosis and perhaps even other areas of pathology. Diverticuli, again, look like the small pockets when viewed on the barium enema exam, small pockets or small peas that have been glued to the outside of the colon. The barium enema is administered usually by instilling dilute barium into the anus and then inflating the balloon of the enema's catheter to help the patient hold and not expel the barium. Here we see a redundant sigmoid loop. This could lead to a volvulus later. However, remember, the sigmoid usually has its own mesentery, which only increases the tendency of a volvulus to occur as it can twist on its own mesentery. This patient has several small diverticuli along the sigmoid colon. Remember, diverticulosis is most common in the sigmoid colon, but can occur anywhere in the colon. There can be diverticuli in the cecum, perhaps even the small intestine, but not below the peritoneal reflection. As we enter these oblique lateral images, we notice how the rectum also takes a very sharp turn. Here, in this image, the splenic flexure is seen. Sometimes trying to maneuver a colonoscope past the splenic flexure is difficult, and too aggressive of attempts can cause perforation of the colon. This study and all the other studies in this presentation are called double contrast barium enema exams because they use two radiopaque materials, air and barium. A single contrast examination is simply a single column of barium or gastrographin. Gastrographin is a hyperosmolar and iodine-containing substance and can be used for both diagnosis and therapeutic purposes, especially useful in patients suffering from severe constipation. The hyperosmolarity causes explosive diarrhea and can treat the constipation quite effectively. In this image, which looks more like your textbook images, we see the entire colon, the appendix, and several diverticuli. And while this is a textbook picture of a colon, note how the hepatic flexure seems to be, again, almost three-dimensional. The rectal ampulla is well distended in this image. Here the patient is lying down with her left side down. This is called a decubitus film. Here, again, the patient is with her left side down. The appendix and the cecum are in the right lower quadrant in the upright position. Notice on this film that even though it was taken in an upright position, there's layering of barium. Go back and look at that for just a second. That's the double contrast we're talking about. The contrast air and barium share in the radiological imaging process. Here the ampulla of the rectum is distended and this film is backwards. How can you tell it's backwards? Notice the sharp angulation of the rectum towards the anus. This helps in maintaining continence. Remember the puborectalis muscle? It's responsible for maintaining this angulation. We see some diverticuli in this image too. Here is a barium enema which I requested to be performed on my patient because I was unable to complete the colonoscopic exam. This colon was too redundant and too tortuous for me to pass the colonoscope safely to the cecum. You'll soon see why. Notice the cecum, which I've labeled, and the transverse colon are quite redundant, especially the transverse colon, which dips down below the cecum. There is loss of haustral markings because the colon had been distended with air during the colonoscopic exam, and because of the redundancy of the colon, I was unable to cannulate the cecum with the colonoscope. In this image, the cecum lies above the transverse colon. If this patient had appendicitis, they would have pain in the left upper quadrant of the abdomen, not near McBurney's point. Again, the rectum is angulated to help with continence. This image is backwards, but the cecum is well distended. Another example of a patient I was unable to safely cannulate the cecum during an attempted colonoscopy. And after many attempts, I simply gave up and requested a double contrast barium enema to be performed by our radiologist. This was a quick introduction to the barium enema exam. I hope that it was educational and removed some of the mystery behind the importance of this examination in patients suffering from all kinds of colon pathology. Later in your courses, you'll understand and learn the indications for obtaining one of these examinations. Thanks for listening.